Good morning, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Chief Darren Rizzi from Mississauga Fire and Emergency Services, Sam Rogers, our Director of Enforcement, and this week, we're once again joined by Dr. Abu Sharkawi, Internal Medicine and Infectious Disease Specialist at the University Health Network. I've asked Dr. Sharkawi here today to talk a little bit about the safety of mixing vaccines. As I know there's been some apprehension over the last few days as a result of some of the comments that were made by the World Health Organization's Chief Science Advisor. I'm hoping Dr. Sharkawi can put those comments into context and talk about why it is in fact safe to mix vaccines and why it is so important that people don't hesitate to get their second dose. Tomorrow is a very significant day for Ontario as we move into Step 3 of the province's roadmap to reopening. I want to first thank Premier Ford and the Government of Ontario for providing clarity to residents and businesses well in advance of moving into Step 3 with guidelines which were released last Friday. I had been advocating for this along with the other GTHA mayors, as it was the information that people needed in order to prepare, especially for our small business community. The first two steps of the province's reopening plan largely focused on loosening of restrictions on outdoor activities. Step 3 makes sweeping changes to guidelines around both indoor gatherings and large outdoor gatherings. So needless to say, this is a very big step forward for Ontarians. I want to walk you through some of the major changes coming into effect tomorrow. Outdoor social gatherings are now permitted to have upwards of 100 people. Indoor social gatherings are permitted with up to 25 people. Indoor dining is permitted with no limits on the number of people per table, with physical distancing rules still in effect. And I am particularly excited that indoor sports and recreational fitness facilities can open at 50% capacity of indoor space. Indoor fitness and recreation have been closed in Ontario since October of last year, so this is a giant leap forward. Among other new guidelines, indoor meeting and event spaces are permitted to operate at 50% capacity or at a maximum of 1,000 people. Essential and non-essential retail will only be restricted to the number of people that can maintain a physical distance of 2 meters. Similarly, personal care services, including services requiring the removal of a face covering, will only be restricted to the number of people that can maintain a physical distance of 2 meters. Concert venues, cinemas, and theaters can operate at 50% capacity indoors or at a maximum of 1,000 people for seated events. Outdoor capacity for unseated events will be at 75% capacity, up to 5,000 people. Fixed seating outdoor events can have up to 75% capacity or a maximum of 15,000 people. Here at the City of Mississauga, this also means some very significant changes too. Our community centres, our arenas, cultural facilities, and libraries will begin reopening to in-person activities over the next 2 weeks. I know that many of our residents have greatly missed these services as they're so essential to their health and well-being. So I'm absolutely thrilled that we will be up and running shortly. Over the coming weeks, we will be providing regular updates about openings here at the City, so please stay tuned. I know just how important these changes are to our small businesses, particularly our gyms and restaurants, as they can once again provide services to their customers indoors. And I'm very happy we are again moving closer to some sense of normalcy. The normalcy that we have all been missing in our lives. With the further loosening of restrictions, I do want to remind all of our business owners to please take advantage of the free rapid testing kits that the Ontario government is providing to small businesses. You can order test kits directly through the Mississauga Board of Trade's website at mbot.ca. MBOT has a free toolkit to help businesses better understand how to employ rapid testing in the workplace. I know how important it is to our business owners to keep their staff and customers safe, so please look into this great resource at your disposal. We are entering Step 3 a week before we had initially planned, and I know the Ontario government, as well as all of us here in Peel Region, will be watching our COVID indices and our case counts very closely. I do want to make it clear that I am confident about moving into Step 3 at this point. And that's because we continue to see a very low degree of community transmission here in Peel, and we have reached a significant milestone in our vaccine rollout. Peel Region is averaging just under 10 cases per 100,000, slightly up from 7 last week. Mississauga is averaging 7 cases per 100,000, steady from last week. The situation at our hospitals remains stable, with 12 COVID hospitalizations at Trillium Health Partners and only 1 patient in the ICU. The situation is similar at Brampton's William Osler Hospital, with 9 COVID hospitalizations and only 2 patients in the ICU. These low case counts and hospitalizations are most certainly the result of people listening to the advice of public health and the huge sacrifices that we have all made. And of course, it's because so many residents have stepped up to get the vaccine. What's become abundantly clear is that vaccines work. Some vaccine skeptics point to the fact that the case counts were very low at this same time last year, and that COVID is simply a seasonal virus. But here's the reality. Last year, we weren't dealing with the Delta variant. This year, we've been able to keep case counts trending downwards despite having the much more transmissible Delta variant in our midst. And again, that is because of the vaccine. We have now administered 1.95 million doses of the vaccine here in Peel Region. That translates to close to 79% of residents 12 plus with 1 dose and 54% with 2 doses. Province-wide, 17.4 million doses have been administered, with 78% of Ontarians 12 plus with 1 dose and 56% with 2 doses. This week alone, Peel administered 152,000 doses of the vaccine, with more than 10,500 doses administered at the all-night Dusk to Dawn event at the Save Max Centre this past weekend. It wasn't that long ago that I was up here fighting to get more vaccine available in Peel Region, when only a tiny fraction of our adult population had had a 2-dose coverage. When our hospitals were completely overwhelmed with COVID patients. We have come so far in just a few months. And because of this progress, we will soon be scaling back operations at some of our mass vaccination clinics. Now, this is a good news story, and it means that the mass vaccination clinics have done their primary job, getting the majority of our residents vaccinated. So effective July 26th, the mass vaccination clinic at the International Centre will close. And while other mass vaccination clinics will remain open, hours of operations and appointment availability will be adjusted over the next few months. But I want to be very clear. This doesn't mean that we're taking our foot off the gas. We are continuing to push forward to reach our goal of getting 75% of our residents fully vaccinated. We need to keep pushing, because the more people we get vaccinated, the less likely we'll see a sudden reversal in our fortunes. Peel Public Health will be shifting some of their resources to get to our hardest-to-reach residents vaccinated, through continued vaccination of homebound residents and through pop-up clinics in the community. Residents still have time to book either their first or second dose at mass vaccination clinics, with literally thousands of appointments still available over the coming weeks. I really do encourage you to book the next available appointment. If you have a family member, friend, or a neighbor who is hesitant about getting the vaccine, please encourage them to get vaccinated. Tell them your own story about why you decided to get the vaccine. If you're hesitant yourself, please reach out to those you know who have received their vaccine, or talk to your healthcare provider. The easiest way to book a vaccination is by visiting the online provincial booking system or by calling 1-833-943-3900. For information on upcoming pop-up clinics, please visit peelregion.ca/COVID-19 vaccine. The progress we have made is outstanding, and I'm thrilled that we are now able to see more reopenings tomorrow. I do, however, encourage residents to continue to remain vigilant as we enter this new phase. Step 3 allows for close indoor contact for the first time in close to a year, and COVID is still in our community, so we simply cannot afford to let our guard down. Please continue wearing your mask in all indoor public spaces. If you have COVID symptoms, even if you're fully vaccinated, please go and get tested and self-isolate while you're awaiting your results. With the loosening of restrictions comes great individual and collective responsibility. And it's up to all of us right now, in this moment, to do everything in our power to protect the significant gains that we have made as a community. Before I bring up Dr. Lowe, I just want to speak a little bit about something that is getting quite a lot of media attention right now, and that is vaccine passports. There are reports that the province of Quebec could adopt a vaccine passport system if the province sees increased in-case counts. Earlier this week, we saw the Toronto Region Board of Trade call on the Ontario government to introduce a vaccine passport system for non-essential business activity. Just as European nations like France are beginning to make vaccine passports a part of daily life, I think both the federal and provincial governments need to give the idea of a vaccine passport some serious consideration. We know that when international travel resumes, residents will be required to show some proof of vaccination. We are already seeing some institutions, like Seneca College, making the decision to only allow vaccinated staff and students on campus for in-class learning in September. Many important questions remain, however, unanswered about how a passport could work. These questions include issues of legality. For example, will businesses and public institutions be allowed to refuse service to unvaccinated people? Will there be protections for people with medical exemptions from the vaccination? And how do we protect our personal information? The Ontario government has signaled that they will not be issuing a vaccine passport for Ontario residents. And the federal government has signaled they believe this is a provincial matter. But with the likelihood that more and more private institutions and businesses will start requiring proof of vaccination for entry and for services, we do need to find a safe and reliable way for Ontarians to prove their vaccination status. Mississauga, tomorrow we are entering a new and a very exciting step in our COVID recovery. I'm so excited for all our residents to get back to more of the things that have become essential to their health and well-being. I'm excited for our business owners to open up their doors to more customers. And I really can't say this enough. Please remain vigilant. Please be careful. We haven't been around this number of people in a very, very long time. Continue to follow the advice of public health. And if you haven't booked your first or your second dose, please do so as soon as possible. And now, I'd like to invite up Dr. Lowe to give us his update.
Good morning. Thank you to you, Madam Mayor, and to Council for your continued leadership. And a special thank you to you, Dr. Sharkawi, joining us virtually. It's an honor to share the podium with you, and it was an honor to have you with our final push at our Dusk to Dawn event in the Coast to Coast Challenge. I know many people are curious as to the outcome of the challenge between Calgary and Peel. The final numbers are being crunched, but I think we can all agree that any increase in vaccination in our communities ultimately makes everyone a winner. Together, we are at 7.2 cases per 100,000 in Mississauga and 1.1% test positivity. At this point in time, 79% of our residents 12 plus have now had their first dose, and also 54% are fully vaccinated with 2 doses. We are also delivering on a capacity of approximately 150,000 available appointments every week for vaccination. If you have not had your vaccines yet, please do not delay. The majority of hospitalizations and deaths occurring in Peel and in Ontario are now amongst those who are wholly or partially unvaccinated. If you have not had 2 doses of COVID-19 vaccine, you remain unprotected. In the coming months, we are transitioning our mass vaccination program towards more targeted community outreach. This will shift our existing capacity and result in changes to our clinic offerings. So I encourage you to please make use of the thousands of appointments available this week and next to get your first dose if you haven't yet, or your second dose if it's been 28 days since your first. Do it today and take whatever brand of mRNA vaccine is available. I can share that today, as yesterday, we are offering walk-in appointments at our Save Max and our Paramount Fine Foods centers, and I encourage you to visit our website or check the Region of Peel's Twitter for details on the hours and when you can walk in. I also want to reiterate that mixing brands is safe and effective. It gets us to 2-dose protection sooner. And I want to say a special thanks to the many residents who have taken whatever doses have been available to get to complete protection. You have made a difference, and our current trends and numbers reflect that. We continue to offer mRNA vaccines at all of our clinics, and I ask that you please respect our staff. They can't change the vaccine for you, and I respect that you may be frustrated at times, but there is no excuse for abuse or harassment. As supply improves, we are going to start offering special dose days to ensure that those who are delaying protection on the basis of brand and not science can access protection. Tomorrow, we will launch our first Pfizer Friday at all of our mass clinics. This will be by appointment only, and no walk-ins will be allowed. But all Region of Peel public health clinics tomorrow will be offering Pfizer. You can book on the provincial booking system to access your dose. I want to be very clear that this is in supporting brand as opposed to science, and we will announce such occasional events of special dose days where supply permits us to do so. Otherwise, I encourage everyone to remember that the products are equivalent, and I thank you for getting 2 doses of any product as quickly as possible. We should also remember that from a global perspective, the difference in brand is academic. And there are countries around the world, even wealthy ones like Australia, who are stuck in a cycle of lockdowns and hard border closures and mortality and disability because they don't have nearly enough vaccine. At the same time, as we look forward, we know that countries which were vaccinated and reopened too quickly before us are now also dealing with surges. So we are fortunate in Ontario that we actually have vaccine availability and increasing coverage, and that we continue to take a cautious approach to emerge from the acute phase of the pandemic. It means that so many more of us can get protected and get protected quickly using every available product, and it gives us hope that when we reopen for good, that the chain between cases and severity is fully broken. Our progress is thanks to everyone who has rolled up their sleeves and taken available doses to push towards the province's targets of 80% first dose and 75% 2-dose coverage among our eligible 12-plus populations that is required to start contemplating an end to the reopening roadmap. But we can and should go higher. I think we have the opportunity to reach everyone and become one of the most protected communities in the world. So I encourage you all to please continue to stay safe, follow the precautions, and gradually increase your contacts as we move into stage 3. And please do your part to get vaccinated with 2 doses as quickly as possible, 28 days after your first dose, and a first dose if you haven't had one yet. Let's keep moving forward. Let's all do our part to end the acute phase of the pandemic. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. Earlier in the week, the Chief Science Advisor of the World Health Organization made some statements that appeared to question whether the mixing of vaccine brands was safe. While the WHO has now clarified those statements, I know that some people may still have some questions about the safety of mixing vaccines. So, to help us unpack what happened earlier in the week and to provide some perspective on the safety of mixing vaccines, I would like to now invite Dr. Abdu Sharkawi to speak. Dr. Sharkawi, the floor is yours.
Thank you very much, Madam Mayor. Thank you to my exceptional colleague, Dr. Lowe, and to our outstanding members of the Council Chamber, and for inviting me for this very special opportunity to discuss, I think, a watershed moment in our pandemic experience where we are moving forward with a great deal of hope, striving towards reconnecting, reestablishing a sense of true vitality and a success that I think many of us have toiled for very tirelessly and deserve some real merit and reward for, including all of you who are watching this and have sacrificed greatly on many fronts. Thank you for doing so and for being a part of the compassionate spirit that makes our community so special. The pandemic, I think, has been unfortunately hindered and hampered greatly, not only by the ravages of the virus itself, but unfortunately by messaging and communication that is sometimes not ideally framed and unfortunately disseminated in a way that can lead to further doubt, insecurity, and even extreme hesitation with respect to following through on key public health guidance. And in this instance, we're talking about vaccines, which by any measure are incontrovertibly the most important intervention to improve our situation and get us to the road of recovery. It is quite clear if we look at any data and by any metric, in any context, anywhere around the world, that the success of curbing this pandemic has gone in parallel very consistently with the proportion of people that are fully vaccinated and at least partially vaccinated. That is something we cannot lose sight of. Earlier this week, Dr. Swaminathan, the chief scientist for the World Health Organization, was quoted, perhaps out of context, as suggesting that the practice of mixing vaccine platforms, for example, taking an AstraZeneca vaccine and then a second dose or further doses of an mRNA vaccine could potentially be harmful, could potentially be dangerous, and would not be advisable. Unfortunately, these comments were taken out of context because what Dr. Swaminathan had been discussing was in relation to booster doses, and specifically with respect to looking at the global supply of vaccines, COVAX, and other situations where we are dealing with the significant issue of global inequity. We're incredibly fortunate here in Canada that we're marching ahead with vaccine coverage that has established ourselves as world leaders in terms of getting people to first doses and second doses for that matter as well. There are many other nations around the world, unfortunately, who have not been so fortunate, that are still struggling even to get first dose coverage broadly established across even their most vulnerable populations. My belief is that the intention of Dr. Swaminathan and the World Health Organization was to try and ensure that this practice would not be perpetuated, so that nations that have an abundance of vaccines would not seek to get third and fourth doses and booster doses and allow people, individuals, to make decisions about taking vaccines from one platform or the next on their own, without the guidance of public health units, without the guidance of a jurisdictional purview. I think that makes a great deal of sense. We have to remember that this is a global pandemic in every sense. As travel restrictions loosen, we know for a fact that there will be importation of cases from all regions of the world where variants of concern emanate. And we have seen these variants emanate from multiple continents, including South America and Asia and Europe. There is no risk of this vaccine disappearing, of this virus disappearing with variants not eventually emerging from other corners of the world. So we must understand that in order to keep ourselves protected here at home, in Canada, and everywhere, we must establish a safe protocol and a safe vaccine campaign everywhere around the world, or it will simply be a matter of time before this situation reignites itself. So I think the perspective of the World Health Organization was based on a global equity and a perspective to ensure that we looked at this from a global lens. Unfortunately, what was distilled from this message was that the practice of mixing vaccine platforms in and of itself was one that was inadvisable. That is certainly not the message that anyone should be hearing. Why is that something that is important to know? We know from history that the concept of mixing vaccines is absolutely safe, and in fact, it's quite effective, sometimes even more effective than taking vaccines from a single platform. One of the best examples that I can think for this is something called pneumococcus. This is a bacteria, otherwise known as Streptococcus pneumoniae, and this is the most common cause of meningitis, of upper respiratory tract infections like sinusitis, ear infections, whether you're talking about kids or older adults, and pneumonia. These are big killers. These are leading killers with respect to infectious diseases around the world. We now know that using two different types of vaccines that affect two different types of immunity, when they are spaced 8 weeks apart, is a more effective strategy than giving one of these vaccines alone. This has now become standard of care. I practice this in my clinic, in my HIV clinic, in my internal medicine clinic, in my infectious disease clinic, in the hospital when I see sick patients who are recovering from pneumonia and have chronic lung disease, heart disease, etc. So the concept of mixing vaccines is a good one. It is a safe one, and it is actually a more effective one in many cases. It is true we don't have huge randomized controlled trials that have proven without a doubt that mixing an AstraZeneca vaccine with a mRNA vaccine like Moderna and Pfizer has shown to be a tremendously effective and incredibly safe option. But we have seen a significant amount of real-world evidence, and we are seeing fairly robust emerging evidence from 3 different countries, the United Kingdom, Germany, and Spain, indicating that not only is this effective, it may be more effective because the antibody response that is compared, looking at a mixed platform compared to a single platform, is better than using the same platform. People are concerned about safety, rightly. I understand that. What we're seeing from this strategy is an increase in short-term side effects, a matter of probably a few days with respect to things like fever, flu-like symptoms, etc. That, if anything else, is a reflection of a more robust immune system, of a more impressive immune response than would be the case had someone received 2 doses of AstraZeneca or 2 doses of Pfizer or 2 doses of Moderna. Again, this is a good thing. So I would caution against the concern that this is going to be a safety issue. I think this is going to be a great situation moving forward. And it's precisely the reason Canada did what it did in terms of procuring as much vaccine as possible from many different platforms. This gives us the flexibility and gives us the ability to do what we can to optimize our immune response and to provide it as widely as possible to every citizen who's eligible to receive the vaccine. As we move into step 3 here in Ontario and we talk about loosening of restrictions, it's incredibly important not to let our foot off the gas, as Mayor Crombie mentioned. This is not the time to get into either vaccine hesitancy or vaccine complacency. The data is good. I was heartened and incredibly proud and hopeful when I spent this past weekend with Mayor Brown from Brampton and Dr. Lowe at the Save Max Center in Brampton, seeing the number of people getting their second dose and being happy that it was Moderna, knowing that they had received Pfizer or AstraZeneca for their first dose. I was disheartened when I saw people walking away from similar clinics in Brampton yesterday. We need to get that confidence back. We need to remember to go by science, to go by logic, and not to go by hype and poor messaging. I promise you, we will not lead you astray. Finally, I mentioned vaccine complacency. As Mayor Crombie mentioned, we are loosening restrictions and we're doing it very, very quickly. That means that there is going to be a temptation and a real yearning to go full force ahead and get back to things in a pre-pandemic state. While I know we all really want that, we have to be careful and mindful of the fact that we're not quite there yet. The limits that are provided specifically with respect to indoor gatherings is something that should be adhered to. It's not something that we should look at as a rough guide. We know that important holidays are coming. Next week, on Tuesday or Wednesday, Muslims across the world, including here in Peel Region, will be celebrating the festival of Eid al-Adha, the festival of sacrifice. This is probably going to be the first opportunity to celebrate an occasion of such import in as close to an organic fashion as we have seen, whether we're talking about observing ceremonies within mosques or having celebrations outside of the mosques with our friends and families. Please do not take liberties with this. Ensure that you are following the guidance of public health, that as much as possible, you are maintaining physical distance within indoor environments, especially if there are unvaccinated or partially vaccinated individuals within those environments. This is a celebration of hope. Let's not forget, as we're approaching the festival of sacrifice, that our sacrifices should not be undone. I'm greatly indebted to Mayor Crombie for giving me this opportunity to share my insights with you, to Dr. Lowe for his outstanding leadership in Peel Public Health, for everyone within Peel Public Health in the region of Peel for making me proud of being part of a community that cares, looks after its citizens, and has a progressive, inclusive mindset when it comes to taking care of everyone who lives within our neighborhoods and keeping us safe. Thank you very much.
Thank you, Dr. Abdu Sharkawi. Those were very important insights, and we appreciate you providing that context for our residents. So thank you for joining us today. So now, along with Dr. Lowe, Chief Rizzi, Sam Rogers, and Dr. Sharkawi, we are happy to take questions from the media.
Mayor Crombie, your first question comes from Christina Tenalia at CP24. Go ahead, Christina.
Hi, Mayor Crombie. Hi, everyone. Thanks for taking my question here this morning. Good morning.
Good morning.
Mayor Crombie, good morning. You spoke about vaccine passports and your concern, noting that the federal and provincial government should seriously consider this. We have heard, even once again yesterday, from the Solicitor General, there is no parameter where you would need to prove anything provincially. These decisions are made by businesses. We have heard from lawyers as well. Businesses can exclude people from their businesses. They do risk, though, potentially discriminating against someone in a lawsuit. In saying that, though, considering businesses can exclude people, do you sense a lack of awareness in your city amongst residents that, if they don't show proof of vaccination, they could be turned away from a business? And are you concerned about any kind of hostility between businesses and customers like we saw with, anti-maskers?
Right. It's a very important question, and this is very topical right now, and it's something that both senior levels of government need to come to terms with. We would think naturally it would be a federal matter, given that there is great interest in a vaccine passport for international travel. But what we do see at the provincial level and at the local level, that our businesses are giving this some serious consideration. They want to know who they're admitting into their retail establishment, whether that person has been vaccinated and whether they're fully dosed. But yet, I am very concerned about the possibility of some discrimination against people who do have a medical exemption for vaccines. So this has to be given some very careful consideration before moving forward. Now, the provincial government has signaled that they're not moving forward with a vaccine, but it does leave that door open for the federal government with respect to international vaccine passports that go further than just the Arrive Can app, which currently exists, so people can easily download their information onto the app and prove to Customs and Border Immigration when they're crossing international borders that they have been fully vaccinated.
Mayor Crombie, I do have a second question. I just want to follow up again from my first one. Are you concerned about any hostility potentially between businesses and customers? I mean, showing someone your proof of vaccination is your personal health information.
Exactly. So there's always that risk. How do we maintain the privacy of our personal information? And in addition, we saw the reaction to some individuals who were not masked while in retail or grocery establishments, and having medical reasons for not being masked. We did see some resistance and some discrimination against those individuals. Dr. Lowe, maybe you want to comment on this issue as well. I think Christina would appreciate your insight into vaccine passports. I'm just going to ask Dr. Lowe to come to the platform as well. Thank you.
Thank you, Dr. Lowe. I know you made a few comments about this yesterday, but yes, if you're willing to expand, please.
Yeah, I think it's really vital to highlight that, I think there is that right for businesses to choose who they admit and who they deny entry to. That has been, as I understand it from legal advice, that is something that they have there. I think the question around, this is an individual's personal health information, I think it really speaks to the challenges that are inherent with any sort of system, but there is also, at least from a privacy perspective, a question in terms of how the information that is being sought might be used or might be stored. And I think if it's for the purpose of accessing a business and it is not recorded, it's not identified in some form, there may be ways for them to mitigate any risks or concerns that way. In any case, this is certainly an active discussion, as I understand it, at the provincial and federal level. And I think it's really more important to understand that regardless of what happens in respect of vaccine passports, the best thing people can do is really to still actually access vaccination. Ultimately, that is at the base of it, from a science and health perspective, the surest way to protect oneself, and it should be for the basis of really trying to ensure someone's personal health and well-being, as opposed to compliance necessarily with a need to prove that an individual has been vaccinated to access a service. So a good question. I'll pass back to Mayor Crombie.
Thank you so much, Dr. Lowe. I just have a second question for you, Mayor Crombie.
Yeah,
Yesterday, Toronto City Council... Oh, sorry, go ahead.
No, I just wanted to, another thought on the vaccine passport. I think that people will need a safe and reliable method to prove their status either way that protects them and their personal information. And you're going to ask me?
Thank you so much, Mayor Crombie. Yes, one more question. Yesterday, the City of Toronto City Council, voted to rename Dundas Street. I know in the city of Mississauga on June the 30th, it's something your city staff began to study and take a look at it. And at the time you said, June 30th, this is recent, about 2 weeks ago, you said at the time you want to make it clear you're not recommending a name change, but you're not recommending that the city don't do it. Toronto City Council had noted that they have chatted with other municipalities. It's up to your council to do what they wish. I mean, does it make sense that Toronto changes the name of Dundas Street and Mississauga were to keep it? And if so, what message does that send?
So, look, I think this is a really historic moment and opportunity for us to come to terms with our past. I think it's something that has to be looked at very closely. And it's also a very important step in the reconciliation process, not just for Black and Indigenous communities, but also all racialized and marginalized communities. So what we asked for was a broader review, not just on Dundas Street, but for all street names that might be impacted, and there are quite a number here in Mississauga. So it will be a much broader review than Toronto has done. But yes, we're very aware of the motion that was passed at Toronto City Council yesterday, and of course, for continuity's sake, it would make a lot of sense. However, we do have some councillors that are concerned about the cost impact, especially during the time of COVID when we're facing huge operational deficits. So we're going to balance those two issues, and I know that once the report comes back, whether it will be in the fall, I think they're going to come back with the framework of the larger review, and I really don't expect a full report back until at least the spring, where we'll have the larger discussion. And certainly not only will Dundas Street be impacted, the town of Dundas will be impacted, and many other street namings or renamings as well.
Mayor Crombie, your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Good morning, Mayor Crombie. How are you?
I'm very well. How about you, Steve?
Not too bad. I wanted to ask you about the timing for opening some of the city facilities under Step 3. As you know, the many openings are possible kind of starting tomorrow morning. Can you take us through why kind of indoor arenas, fitness centers, and indoor pools in the city are opening sometimes maybe a week after they were able to open under the province's rules?
Right. So certainly with respect to the indoor pools, those all face inspections. And so we're waiting to get all the pools inspected, and they have to be approved before they can be reopened. We have to go in and we have to clean the facilities, recall staff. Staff have been laid off since last April, I believe. So many have moved on to other employment. So it's a question of staffing up, training, reopening. You can well imagine that might take more than 1 week. So over the course of the next 2 weeks, we will be reopening all of our facilities.
Thank you. And actually, just a question for Dr. Lowe on the Pfizer Friday
Absolutely.
Good morning, Dr. Lowe.
Morning, Steve.
Just had a question. Wondering if the Pfizer Fridays, can you kind of take me through the thought process there? And is this a move kind of acknowledging that some residents just haven't been receptive to the idea of vaccine mixing, despite kind of messaging efforts from health officials?
Yeah, Steve, I think it's, let's be clear. The science is clear that the vaccines are bioequivalent and are interchangeable. However, we do recognize that there are individuals for whom they are seeking a specific brand, and even the science doesn't necessarily convince them. So in view of that, to really make sure that we are still trying to get people to access protection as quickly as possible, we will be offering on occasion special dose days such as Pfizer Friday, as we will be doing tomorrow, and I encourage all of our residents who are seeking that specific vaccine product to ensure that they are booking online at the provincial vaccine portal. It is important for me to clarify again, though, that the science is pretty clear, and the reality, especially as we are trying to continue our assured reopening, in the context of increased contact and interaction starting tomorrow in stage 3, is that everyone should really be trying to access 2 doses as quickly as possible in any combination. Thanks for the question.
Next question.
Your next question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
Hi, good morning.
Good
My
morning.
first question will be for Dr. Lowe.
Certainly, no problem.
Go ahead, Natasha.
Yesterday, Ontario's public health officials said that they were expecting a surge of cases in the fall. Do you think that this could turn into a potential 4th wave, especially in Peel with, our history?
Well, it's very interesting, and that really speaks to the need for everyone to get vaccinated as quickly as possible. Vaccines help to attenuate and reduce transmission, but they also help to protect individuals from needing hospitalization or other severe outcomes. So if we can get to a situation where, yes, there may be increased activity in the fall, but it is all mild disease, then that is a different situation. But that ultimately really means it's in all of our hands, in all of our arms, if anything, to make sure that we forestall any resurgence, particularly as we reopen into stage 3 starting today, or rather at midnight tonight, and also as we move back inside in the fall, where we know that COVID has a propensity to spread. It requires us to continue following the requisite precautions as well, distancing, masking. Right now, those can only be lifted in situations where you are indoors with a small group of fully vaccinated individuals or outdoors, and you yourself are fully vaccinated. But in large crowded situations in indoor public spaces, it is going to be still important for us to continue masking and distancing and ensuring where we don't know other people's vaccine status, ensuring that we're sticking to those precautions so that we can monitor and ensure that we aren't seeing a resurgence. Thanks for the question.
Thank you. Next question, please.
Follow-up, Natasha?
Yeah, so this one will be for you, Mayor Crombie.
Certainly.
Port Credit Library was built on a dumping ground in the 60s, and in 1992, the city redid the support structure. After this history, the city did then a renovation in 2012 that cost $3 million. After closing to the public last week, will Mississauga continue to try to repair the building, or will it be needed to be torn down?
So we're waiting for the assessment to come back, the engineering assessment and study. My view is that, unfortunately, that building may not withstand building code standards today, as we've seen it sinking for some time, and it may have to be rebuilt.
Your next question comes from Steve McCarr at Mississauga. Go ahead, Steve.
Hi. The question is for Dr. Lowe.
Certainly, Steve. Welcome today.
Thank you.
Go ahead, Steve.
Yeah, the question is, I guess next week is the ban on flights from India could be lifted. Do you think, considering that flights are still coming in with people who have the virus, do you think the flight ban should continue?
Yeah, it's a great question. I think certainly the flight ban, as I understood it, concerned nonstop flights from India. It did not, it did not prevent necessarily individuals from transiting via a third country. And I think the more important point is it really comes down again to vaccination coverage. At some point where we reach, higher and higher levels of vaccine coverage in our community, then the threat that is posed by variants and other, spreading elsewhere in the world becomes diminished somewhat because of the reduced novelty in the population, the reduced susceptibility in the population. So I think it really is up to the federal government to respond. Certainly, I know that the situation in India, I believe, has resolved after the second wave, but they may be seeing an uptick in that country. And so I think the decision in respect of that flight ban, as well as continued measures at the border, ultimately will be taken by the federal government, considering both our domestic situation as well as situations in other countries abroad. Thanks for the question.
Second question is also for Dr. Lowe.
Yes. All right. Dr. Lowe.
Yeah. Sorry, Steve.
Hi. There's be a bit of confusion by people who have received both doses. Some people in Peel Region say that they were issued some sort of certificate after the second dose, while other people say that they weren't issued any kind of form. How can people in Peel Region prove that they've been double vaccinated?
All individuals receive a proof of vaccination that is emailed to the address that they use to book their appointment, or if they provided an email at a walk-in appointment, their proofs of immunization are emailed there. I would encourage people to check their spam folder in the event that they don't have that proof of vaccination. And then if they are unable to access that proof of vaccination electronically, they can call the provincial booking line for assistance in accessing their booking confirmation. But all people who are provided, who receive a vaccine in Peel are provided a proof of immunization, and if they don't have that, they can call the provincial booking line for further information. Thanks for the question.
Thank you.
Next question, please.
The last question comes from Khaled Salama at My Second Home TV.
Welcome,
Go ahead,
Khaled. Welcome, Khaled.
Good morning, everybody.
Good morning.
Thank you so much.
Thank you.
Can you please update it on the LRT progress and whether the pandemic impacted the timeline, and also would we see any potential closures on Highway 10?
Well, so certainly if you're driving north or south on here, Ontario, today you will see a lot of construction work ongoing. This is the beginning of the building where they are moving, they are actually expanding the road in some cases. In other places they're moving pipes and underground services. I had the opportunity to tour the facility that will hold all the train cars on, I guess a week ago, on Friday, and it's very exciting to see their progress. So we are full steam ahead on the progress of our LRT, and I'm very hopeful that by spring 2024 or the latest the fall of 2024, we will be riding on the Mississauga Hurontario LRT. So it's very exciting news, and yes, you're seeing some construction that is all LRT related on Hurontario today.
Thank you. And may I ask Dr. Sharqawi?
Sure.
Thank you so much. Dr. Sharqawi, did you have a chance to contact Dr. Swaminathan and discuss her stance on what drove her to provide this statement?
I didn't speak with Dr. Swaminathan personally. I know of her reputation as certainly an outstanding scientist and a really credible leader in terms of her work with the World Health Organization. And I'm certainly not going to be inclined to make this an opportunity to point fingers at her. I think that, as I mentioned before, the comments that were made were intended to ensure that decisions were not motivated by individuals, by people choosing one brand over another, particularly in parts of the world that were already managing the pandemic much more effectively, and were in a situation of privilege, frankly, by talking about booster doses. We have to be mindful of the fact that as we look at reopening here and getting back to reconnecting in a world of normalcy in Canada, there are still many parts of the world that are suffering tremendously. And I believe Dr. Swaminathan's comments and her intent was to ensure that we did not take it for granted when we were talking about hoarding vaccines and deciding that individuals in resource-rich parts of the world would be making individual decisions about that. I don't think that the concept, again, of mixing platforms is one that Dr. Swaminathan or the World Health Organization is against. I do believe that the words that were used with respect to data-free, evidence-free zone were probably not well chosen. We've been pretty clear about that. We have, rebutted that with the fact that there is very good real-world evidence from not insignificant numbers of people being tested in, again, the UK, Spain, and Germany for this working and being more effective. And I just want to, mention Mayor Brown and I, when we were at the vaccine clinic, the marathon clinic in Brampton over the weekend, we came up with a nice analogy that was used in terms of gas. We tend to think about these vaccines as being so different in many ways. But at the end of the day, whether they are an mRNA vaccine or a vector vaccine, they do the same thing. They allow your body to make the spike protein and then to develop antibodies that are going to fight this virus if we see it. So if you fill up your gas from Shell or Esso or Petro-Canada, I don't think you're going to think twice when you're bone dry in the tank a week later about going to a different gas station, because at the end of the day, it's the same result, that the gas helps your engine work, it makes your car move and allows you to get from one place to the next. So as I've said, fill up your tank, fill up your immunity. It really doesn't matter what brand you're getting in the vast majority of cases. And that's the best way that we can protect ourselves and not get lost in any communication issues.
Thank you.
That was our last question for today, Mayor Crombie.
Thank you. Thank you all for joining us today.